This video is for women who have had tears or stitches after the birth of their baby. Up to 90% of women tear during childbirth. The perineum is where most women will tear. This is the area between the vagina and the anus. Tears go from 1st to 4th degree. A 1st degree tear is a small graze. A 2nd involves the skin and the muscles of the perineum. A 3rd involves the muscles around the back passage, and a 4th extends further into the back passage. 6% of women will have a 3rd or 4th degree tear. It is normal to feel pain for a few days or weeks. Sometimes this can be a dragging feeling or a sensation of heaviness. To reduce the risk of infection and aid healing, keep the area clean and dry. Shower daily. You may want to rinse the area with warm water after using the toilet. Pat dry with a clean tissue and use a hairdryer. Change pads every 2 to 3 hours, washing your hands before and after. Change your position often. Don't sit or stand for too long. You can use ice to reduce swelling. Wrap the ice or a gel pack in a clean cloth and apply for about 10 minutes. Avoid tight clothes, wear cotton knickers, and eat a healthy, balanced diet and drink enough fluid, 2 to 3 litres a day. You may need some pain relief. Discuss this with your midwife. Pelvic floor exercises can help with healing. Do these as soon as you feel comfortable. Do not do them if you have a catheter in your bladder. More information on these exercises can be found on our pelvic floor exercises video. Avoid straining when having your bowels open. More information about this can be found on our bowels and constipation video. It can be helpful to support your perineum and stitches with a clean pad while having your bowels open. You will be advised to take lactulose to keep your poo soft. It is important that you continue with this until your perineum is fully healed, which will be a few weeks. Other laxatives are available, but discuss this with your pharmacist or midwife. Some women may have difficulty controlling their bladder or bowels. This will improve with time and pelvic floor muscle strengthening. For bowel urgency, you can strengthen the anal sphincter by squeezing your anus tightly shut and holding the squeeze as long as you can. Practice this when you have the urge to have your bowels open and try to defer having your bowels open. This is called bowel training. If you have trouble controlling your bowels and your poo is soft, you may need to reduce or stop the laxatives. It is best to resume sex once your stitches have healed and you've stopped bleeding. There is no right or wrong time. Self-examination before the first time may give you confidence that you are ready. Use some lubrication the first few times and start gently. We recommend Yes or Silk. You may feel some discomfort, but it will improve and it will feel different. Different positions may help. Most women make a good recovery, particularly if the tear is recognised and repaired early. But this can take time, possibly months, not weeks. Contact your GP or midwife if you feel unwell or have a temperature. If your stitches become more painful or smell offensive, or if the area starts to throb and is not healing. Contact a women's health physiotherapist if you experience any issues with your bladder or bowels, or if sex is painful.